With its dedicated staff, advanced facilities, and state-of-the-art technology, guys, this hospital has gained a reputation as the leading medical institution in sub-Saharan Africa and beyond, with thousands of patients benefiting from the diverse specialties and healthcare services that are provided here. So don't miss to watch this video and follow us, guys, as we give you a tour of the Radiology Department at the Aga Khan University Hospital. So guys, in this era of digitalization, health services and interventions have been complemented by the use of imaging machines for accurate diagnosis and treatment planning. So today, guys, we are privileged to be at the Aga Khan University Hospital to be touring their radiology department, and we are actually inside the CT scan room, better known as the computerized tomography. And with me here is Sabina Kamande, who is one of the technologists, who's going to take us through their CT scan operations. Welcome to the show.
Thank you. So my name is Sabina.
Yes.
I'm a technologist at the Aga Khan University Hospital. So this is our CT scan room, and with us here is the somatome definition flash, which is a 256 light CT scan. It's a dual source energy. That means we are able to take scans at a very high speed. Okay, so this is a CT scan gantry, and this is where the CT scans are taken. Radiation is produced here, then we are able to produce images electronically, and this is a patient's table. So a patient will lie up here, we'll bring up the table, go into the gantry, take scans, and then from the monitor we are able to see them electronically.
So what type of radiation is it using?
CT scan uses X radiation. Okay, and how it is used, I know many people fear radiation. So there is an X-ray tube and there are detectors. They are very accurate on where they go, such that there is no excess radiation that is produced, and if there is, it's very minimal to acceptable limits. Yeah, so it's very safe. The radiation amounts are very low for any effect that is ever recorded. CT scan is used to do all sorts of diagnoses. Like if a patient has trauma to the brain, you can be able to rule out injury. You can be able to check injuries to the bones, to vascular structures, to organs, to everywhere. If a patient has cancer, you're able to see where the cancer is, you're able to categorize, you're able also to do staging of the cancer. Basically, it's for all diagnosis.
So how do you ensure safety while using the machines, both for the patients and you as the technologist?
Number one, the scanner is made in a way that the radiation is limited to only where we are scanning. Very minimal scatter radiation, which makes it safe for the patient. And also, you only do a scan when it's absolutely necessary. We normally reduce the amount of radiation depending on the age and also where the part that we are scanning, and plus the weight of the patient. So if a patient is small, then they'll get a smaller dose. The scanner has potential to do basically all CT scans. Yeah, so I think it's exactly what anyone would be looking for in a CT scan.
So that's it, guys. You've heard from our technologist here, who is the lead technologist at the CT scan at Aga Khan Radiology Department. So from here we are going to go straight to the MRI, that's the magnetic resonance imaging, and we'll give you a take of how it feels to be there. So come along, guys.
This is one of the two MRI facilities that we have in this campus. This is the 3 Tesla Philips Ingenia 3T. The other one is a 1.5 Tesla. The Tesla is the unit of measurement of magnetic field strength, and therefore this is double the strength of the other one. In this machine, we'll perform all neuro exams. Neuro meaning anything to do with the brain, the spinal column, and in the brain we've got various exams that we perform, including routine brain scans, magnetic resonance angiograms of the brain, that is blood supply to the brain, magnetic resonance venograms of the brain, that is blood drainage from the brain. We also do tumor protocols, that is characterization of tumors affecting the brain. We'll do exams also of the optic nerve, that is the nerve that enables the human eye to see. And we also do exams of the neck. We'll do exams of the cervical column, which is the cervical spine, the thoracic column, which is the thoracic spine, and the lower back, the lumbosacral spine. We also do cardiac MRIs. We do some of the best cardiac MRIs in this region, and even doctors in other hospitals where they have MRI scanners refer patients here for MRIs of the heart. That's cardiac MRI. Basically, that's what we do in MRI, and the exams could be done as routine and they could be done as emergencies. One of the emergency exams that we perform is a stroke protocol, because this hospital is certified for stroke management. So we image that patient within less than 45 minutes, and in the scan, the patient spends 12 minutes in the MRI scanner, and we acquire 4 sequences which are very crucial in determining if the patient needs to go for cardiac embolization or if there is an aneurysm that needs to be clipped with immediate effect by the neurosurgeon.
So guys, we are in the mammography room. This is the machine that is used to detect breast cancer, and I'm here with Vivian, who is one of the specialists in this area. So Vivian will take us through the work and the machine and how it operates.
Basically, a mammogram is medical imaging equipment that uses low dose of x-rays to get the images of the breast. So through mammogram, you're able to detect masses or calcifications that are seen in the breast, which are usually some early signs of cancer. So normally we usually place the breast here, and then we use compression. We compress using these paddles, where we compress the breast here, and then we get, the tube is up here for the x-ray, then we're able to get an image that will reflect on the other side of the computer.
From the mammogram room, we are now taking a tour of the radiology room. This is a conventional radiology machine that we normally know. We call it the X-ray machine. This is used for checking the chest diagnosis, abdomen diagnosis, and extremities. That's the hands and the legs. And I'm here with Alex, who is one of the specialists at this X-ray, who operates this X-ray machine, and he'll be here to explain to us how it works and the modalities that are involved here?
So this is an X-ray machine, Philips C50, very nice machine, and with a dynamic range of movement. As you can see, it's a staying suspended machine.
You can show us the movements, the dynamic range.
Also, you can move up. For the staying suspended, it is that you can perform a procedure from any side of the room.
Alright.
And even while the patient is on the bed, you can't move the patient, so you just move it to where the patient is. And also, you have what we call auto tracking. So it's basically an automatic movement whereby as this moves, this is what we call the vertical standard. So as it moves, this one also moves. And once you're here and you're positioning your patient, you don't have to go back to that one. So you just move this and this one moves. It's a DR machine, meaning you take your images with this, we call this the detector.
Okay.
And then the images appear on the computer on the other side. Yes, so that's our Philips C50.
Okay.
Yeah.
So how do you ensure minimal radiation exposure to the patient?
So first and foremost, it's an activated machine. It has what we call AEC, automatic exposure control. So basically what it does, it chooses the least amount of exposure according to the patient size and age.
So it chooses automatically.
Yeah, it chooses
It can
automatically.
detect.
Yeah. But also as an operator, you also have the option of adjusting the exposures to your preference.
So guys, as we move on with our tour of the Aga Khan Radiology Department, here we are at the Cardiology Center where we are going to tour their Cath Labs. So keep it locked guys and come along. If you like our videos, make sure you subscribe, like and share. We are inside one of the Cath Labs at the Aga Khan University Hospitals. This is where they do all the non-invasive heart interventions. So here, these are the machines they use. As you can see, these are all the state-of-the-art technology that has been installed here to make sure that you get the best heart services. So here, I'm going to talk to one of the specialists who is going to explain to us just how all these machines work. I'm here with Roseanne, who is one of the specialists here, who is going to take us along what exactly happens inside the Cath Lab. So Roseanne.
Yeah, thank you. Yeah, my name is Roseanne Nyabera. I'm the cardiology manager for this Cath Lab at the Aga Khan University Hospital. So just to take you through, we have two Cath Labs at the moment. So this is the new one, which is the Artist Q. And what happens in Cath Lab as compared to theater? You know, theater we operate, yes. But for Cath Lab, we do invasive, in that we do procedures without making an incision. The access, normally, it's just a cannula inserted in the vein.
Okay.
So
At any part of the body? On any
yes, so mostly it depends. Like for here, we do cardiology, we do neurology, we do obstetric procedures, we do other interventions, any part of your body where there's circulation. Most of our procedures are cardiology, and then second, they are neurology procedures. like you're aware, we've been accredited for stroke, heart attack care, and stroke care. So majority of our cases fall under that. So once the doctor comes in, then if you're doing cardiology procedures, you'll be able to see on the camera, on this screen, the heart and what they're looking for. This is called a temporary pacer. So we're able to connect the technology that is here, and then we insert it into your heart, and it helps you the heart to beat back to normal.
Still without doing the open heart?
Yes, there's no incision. Yes, we only use the entry, either a vein or an artery, and we're able to do all this. So once this is done, then we set it, and if my heart rate is 80, then we make sure it's at 80, and that helps the heart now to beat well as we continue sorting out the primary issue that brought you here. In every Cath Lab, there has to be a defibrillator, whereby in case your heart stops beating, then we are able to jumpstart the heart to continue. Yes, we have to make sure your heart continues beating until the procedure is done. But most of our patients are stable, so they don't need all this extra. But for us being a center of excellence, we have to make sure we are ready for anything that can happen. In case we are not able to do it here and we stabilize you, then we'll rush you to the main theater now. There you'll be done open heart surgery if you require it at that time.
So guys, as you've heard, this is the center of excellence as far as cardiology service is concerned. The Aga Khan University Hospital has set standards to be the best in as far as imaging machines is concerned for accurate diagnostic procedures. So guys, the Aga Khan University Hospital has invested in a picture archiving and communication system. This is a system whereby all the images are documented at a single place and the reporting is done at a single table. So this also, guys, is an advantage for this facility to have this system, because reports from outreach clinics for the hospitals are sent here. Once an X-ray or an imaging is done, the reports are sent here and the radiology consultants look at the reports and send back the results. So even the turnaround time at the outreach clinic is minimized. So guys, that has been a tour of the Radiology Department at the Aga Khan University Hospital. Thank you very much for sticking with us throughout this video. If you like our videos, guys, don't forget to press the like button. Also, leave a comment down below. Tell us what you think about this video. I'll leave more information about this video on the description box below, so be sure to check it out. Until the next one, bye bye guys.